Hello, my name is Roxana Trejo, and I am glad to be here to have the opportunity to present the work we have actually been working on for the past 2 weeks regarding advancements and innovations in public health, specifically here with cognitive behavioral therapy or CBT. During the next few minutes, I will be sharing information for implementing one of the main innovations to improve generalized anxiety disorder, GAD. First of all, what is generalized anxiety disorder? It is a condition characterized by excessive and uncontrollable worry. Symptoms and signs include restlessness, fatigueness, unable to focus or concentrate, chest pain, and abdominal distress. Other signs can also include headaches, body aches, dizziness, and other numerous signs and symptoms. GAD mainly has affected adults, specifically from ages 18 to 13 in the recent years. So who is affected? The people who are mainly affected are obviously both in the same, are both genders, females and male, but it is said that females are 2 to 3 times more likely to be affected with data that has been found under the CDC. Also, who can be affected currently right now are increasing rates in Gen Z and millennials, especially those in the ages of 18 to 25. Also, white non-Hispanic Americans are more likely to be diagnosed. And then we also have percentages of 30 to 60% of LGBTQ community who deal with anxiety and depression. Potential risk factors include genetic makeup, trauma, stress, biological processes, thinking, and social influences. Why GAD is a public health concern. 1 of 3 adults suffer from it. Young adulthood is a critical stage of life. GAD can be very paralyzing and can affect daily living and daily functioning activities. Anxiety can lead to eating disorders, substance abuse, suicide thoughts, and depression. Available treatments include what we're going to focus on is CBT, and also there is medications with a combination of therapy. Medications include antidepressants and anti-anxiety medications. So the innovation overview, there is recent innovation in delivering methods for effectiveness. There has been advancements, specifically digital advancements in cognitive behavioral therapy. CBT is considered one of the gold standards for psychotherapeutic treatment for GAD. Recent innovations, delivery methods, and technological integration have the potential to enhance the accessibility and effectiveness. The proposal outline is a plan to implement innovation in digital technology concerning CBT. And then we have the main objectives, which is increase accessibility to CBT for those with GED through digital platforms, enhance engagement, retention with gamification, interactive modules, support data insights for personalized approaches, integrate biofeedback and mindfulness training to complement traditional CBT, evaluating certainty of efficacy and scalability. The focus for implementation will also be just on university and the college setting. Positive impacts is what is being expected with digital CBT. We have increased access to treatments, and then we have enhanced treatment effectiveness, improved patient engagement. With increased access to treatment, many people with GAD do not look into receiving the treatment due to barriers like location, cost, and stigma. The mental health field and public health community face challenges to increase access to evidence-based treatments. And then in enhanced treatment effectiveness, personalization, personalization through machine learning and data-driven insights could cause a positive change in therapy outcomes by tailoring interventions to the needs specifically for each individual. The expected outcome is higher rates of symptoms reductions for sure, and therapy becomes more aligned with the individual's needs. Improve patient engagement by having gamification interactive modules make therapy more engaging, or maybe you can say it can make it more fun, interesting. It increases adherence to therapy protocols like completing assignments and attending sessions. Having consistent participation in therapy can lead to better therapeutic outcomes by reducing frequency and severity of symptoms. And then we have resources and barriers. So funding resources can come from the patient's insurance, fees for the platform usage, and public-private partnerships. And then there are bigger resources like mental health organizations, government programs, you can say grants, and private investors. Two that I did find that will be very helpful would be the Community Mental Health Grant Program and also federal grants. The Community Mental Health Grant Program is used for community partnerships to prioritize needs in the community in mental health prevention. Federal grants can be given to local governments, universities, and other various organizations. Then there's also training purposes. Training would be good. That way, whoever is trying to work on this or put more into these platforms, they can be trained in order just to know and also give the information needed to individuals who use the platform. So there is a study done on coaching program to deliver digital mental health intervention. The program, you have to complete 4 sessions and it goes through phases of training, which is beginner, intermediate, advanced, and certified. And then there are barriers and limitations, limited accessibility to technology, initial implementation, and clinician adoption. One of the most common barriers would be the accessibility to the technology. There's a thing called digital exclusion. It happens when people are not able to access mental health services, receive support, or participate in research due to the lack of access to the internet or certain devices, or by not having the skills to even use technology. Key stakeholders, you can see here we have the patient, the individuals using CPT platforms, the mental health professionals, clinicians and healthcare providers, and then the digital developers. So these are the main stakeholders for our proposal. And then the rollout process implementation, phase one would be the development and pilot testing of the proposal. Phase two, training and rollout. Phase three, evaluation and scaling. And we will be using the scaling the GAD-7. And the GAD-7 is a measure that is screened for GAD and assesses the severity of the symptoms by a score of 10 or higher, which corresponds to moderate and severe symptoms of GAD. Evaluation and feedback, those will be measured symptoms with the GAD-7 scale, patient adherence or the use of digital platforms. So they'll see that with the individual doing attending their sessions, and then also their completing activities in the platforms. Also, we will do surveys, patient and therapist satisfaction surveys. We would compare the cost effectiveness to traditional CBT and then ease of integration into various clinical settings. So the justification for a university or college is university and colleges campuses serve as a critical environment for addressing GAD due to the following factors: prevalence of anxiety disorders, access to resources, potential for research and advancement, student faculty well-being, scalability, and community impact. And so we will use the same phases that were described. And then acknowledgement. The AI that was used was ChatGPT. It was asked to search for an implemental proposal for CBD innovations for GAD. After it was drafted, I did go and ask a little bit more. So I went through what we needed to find. And so I did ask for what are possible impacts. Can you find or can you tell me some limitation barriers? Can you show me some numerical data? What are resources to help this proposal? And then can you justify a little bit more on how to propose this implementation plan to a university or college? And then while fact checking, there were a lot of resources used from like maybe 10 years ago or more. So that was a little hard to do. I had to go back myself and find recent resources, and then also ethical and lawful challenges. So with technology nowadays, it's really hard to protect privacy data specifically. I mean, obviously it's HIPAA and everything, so that's a little something we have to take into consideration, and then also ethical considerations within the population. Um, if there are any concerns or questions, feel free to email me. That will be presented in one of the last slides that will be coming up. These are the references I did use to help me find information and obviously make sure that the proposal was um, good to use. This is my contact information. For any further questions, concerns, feel free to email me here at my email, and then I will be adding my presentation link.